Tonight, the emotional reaction to a star athlete's death. Retired NBA legend Kobe Bryant is killed in a helicopter crash. His legacy and the reaction from those who knew him best. Also tonight, the first Canadian case.
We completely understand that there's a lot of anxiety.
What we know about the coronavirus patient in Toronto. Plus, how health authorities across the country are protecting you and how you can protect yourself. And an Alberta family demands answers after a woman dies of dehydration in a long-term care home.
I feel like a hitman because we were paying to have our mother killed.
This is The National. Kobe Bryant was one of the NBA's most famous and most polarizing players, but there is no argument that he was one of basketball's greatest and an influential figure off the court. Tonight, his friends and fans are reeling. This is the wreckage of the chopper he was in after it slammed into a hillside northwest of Los Angeles. Bryant, just 41 years old. He won 5 championships during his 20-year run with the LA Lakers, a marquee player. With him today, his daughter Gianna, killed along with 7 others. Paul Hunter now on Bryant's life and its tragic end.
Heard an explosion, and for hours afterwards, smoke billowed in the hills outside Los Angeles. The helicopter that had been carrying Kobe Bryant and others lay as a crumpled wreck.
Individuals that saw the aircraft said it was coming down at a fairly significant rate of speed and impacted the ground on the hillside behind me.
Word spread quickly that among those killed was the former NBA star. The shock deepened when it was also learned that Bryant's 13-year-old daughter Gigi was killed alongside him. NBA players throughout the country today were stunned. As the Toronto Raptors got set to play in San Antonio this afternoon, darkness.
Earlier today, the NBA lost one of the greatest to ever play the game.
And after a moment of silence for Bryant when the game began, players immediately paused everything in their own tribute to one deemed an all-time great. Indeed, for 2 decades, Kobe Bryant was a transcendent player. 18 All-Star games as a Los Angeles Laker, 5 league championships, 2 Olympic gold medals, even an Academy Award last year for the short film Dear Basketball.
I ran up and down every court after every loose ball for you.
Incredibly, Bryant once scored 81 points, 81 in a game against the Raptors.
81-point game!
But Bryant's career was not without controversy. In 2003, he was accused of sexual assault. He later apologized and settled a civil suit out of court. His popularity waned, though over time it rebounded, and he retired as a fan favorite with a flourish in his final game, scoring 60 points.
Most points scored by a player in the NBA this year.
Tonight, the league, its players, and fans everywhere mourn. Paul Hunter, CBC News, Washington.
Kobe Bryant had that rare privilege in professional sports of being able to play for one team for his entire career, the Los Angeles Lakers, whose home stadium for most of his run was Staples Center. Zuleka Nathu is there.
You can hear the chants outside the Staples Center.
Kobe, 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 Kobe,
this is a juxtaposition of scenes. Outside, you have chants, you have fans that have gathered in droves to the point where it's so packed, we can't even get near the actual memorial of flowers and candles and cards, which are over here. You have pictures of Kobe everywhere. And beyond the barricade, inside the Staples Center, you have the Grammy Awards going on, music's biggest night, people celebrating, and a lot of people out here and online calling out the Grammy Awards for not canceling the show in light of what's happened. There are fans here with jerseys, fans who have grown up with watching Kobe Bryant. And I have 2 here, Adrian and Brandon.
Yes.
So tell me what brought you here.
I mean, Kobe's some guy I looked up to my whole life. I admire this guy. He's a legend to me, and I looked up to him so much. And to have this happen, it hurts my heart, man, because he was a god to me. He was a god, and he was so loved, and it just happened out of nowhere. And it hurts my soul hearing that.
And Kobe Bryant wasn't just an athlete. It was something he wanted to show people that he could do so much more. In fact, in 2018, he won an Academy Award for his animated short film, Dear Basketball. I was in the press room behind the scenes when he won the award, and he wanted to make it known to people that he was not just about athleticism or about sports, that he was still growing and he was still reinventing himself. Zuleika Nathu, CBC News, Los Angeles.
Kobe Bryant's reach extended well beyond Los Angeles, and today people in Canada and around the world paid tribute. Anita Bath has been tracking that part of the story.
I came from this neighborhood and we don't really have many role models to look up to.
Kobe Bryant was more than just a basketball star for Wayne Hong.
So for me, when I see Kobe, I see all the hard work and dedication. He gave me something to strive for.
For some of these folks playing hoops in Vancouver, Bryant played an important role.
His mentality that helped us through school, education, how we impacted the community too. That's what Kobe did for us.
His legacy is complex, but his impact has been felt around the world.
It's very difficult for me to put in words how I feel about the loss of Kobe Bryant.
No words to express the pain I'm going through. I'm sick right now, tweets Shaquille O'Neal. Barack Obama calls Kobe a legend, someone who was just getting started in what would have been just as meaningful a second act.
We didn't see all that we could have seen from Kobe Bryant, and I would have liked to have seen what else he would have accomplished with his life.
NBA Commissioner Adam Silver says Bryant was generous with the wisdom he acquired and saw it as his mission to share it with future generations of players. True words for these fans in Vancouver.
Growing up as an immigrant here in Canada, just persevering through a lot of tougher times, he's motivational to I think a lot of people in the basketball community.
And outside Bryant's Mamba Academy, a growing memorial and a moment of silence from young players hoping to one day be just as good as their idol. Anita Bath, CBC News, Vancouver.
Kobe Bryant's last public pronouncement came on Twitter last night in response to this.
There's James, goes across the lane, lays it up, and lays it in, and there it is. He just became the third leading scorer in NBA history, passing Kobe Bryant.
Kobe's words of praise continuing to move the game forward, King James. Much respect, my brother. Hashtag 33644. King James, of course, referring to LA Laker LeBron James. And that number is James' all-time score, breaking Bryant's record. The other major story we're following tonight, the spread of coronavirus. Canada now has one presumed case, and the expectation is there will be more. Still, the message from health officials today, the risk of an outbreak here is low. In China, it's a very different story. The number of confirmed cases now tops 2,700. The number of deaths, 80. We'll take you there as hundreds of doctors and the military pour into the city at the center of it all. Here at home, we'll look at how our federal government is responding and what we're learning about how the virus might spread. But we start with what is known about that Canadian case and the search now underway for some of the people who were on that man's flight to Toronto. Here's David Common.
The 50-year-old man left Wuhan, China, the virus's epicenter, on Tuesday, later boarding a 16-hour flight to Toronto. It was on board that symptoms first appeared, though on arrival at Pearson Airport, no flags were raised by officials.
This patient was not reported to us, no.
5 days later, authorities are now searching out and contacting passengers seated within 2 meters of the infected man.
On Wednesday, he walked out from here, headed home in a private car, but by Thursday, his symptoms were worsening and his family called 911. That prompted the health system that had long prepared for this moment to kick into high gear, sending paramedics to that home in protective gowns and masks.
It would have looked something like this as the ambulance brought him here, Toronto's Sunnybrook Hospital, which immediately put the man in isolation.
The patient will not be discharged until we can be assured that they have fully recovered.
Meanwhile, a passenger from the man's flight tells CBC he was not contacted by public health. So he called them and says he was told to monitor himself for symptoms. He's chosen to self-quarantine for 14 days because he doesn't want to be a burden to society. He did not want to be identified, worried about the stigma associated with coronavirus. pointing out Chinese Canadian children he knows are being bullied and told to keep a safe distance by other kids. The first patient's family is quarantined, though at home. He is in stable condition in hospital. A good reminder that while coronavirus can be deadly, it has only been in a small minority of cases.
We completely understand that there's a lot of anxiety and questions in the general public, and that is very understandable.
The virus is now crossing borders really around the world, a step that health authorities say was inevitable because it's being carried by infected passengers from China. Those health authorities now preparing for the potential next wave, and that is the possibility of human-to-human transmission right here in Canada. But for most people, they stress, that is very unlikely. David Common, CBC News, Toronto.
That message to stay calm but vigilant is coming from the federal government today. Ashley Burke with how it's responding to the virus's arrival in Canada and the anxiety that came with that.
Canada's top health officials want to make it perfectly clear.
The risk is extremely low for Canadians, that there is no need for Canadians to be alarmed.
They're battling fear and also misinformation that's popping up on social media.
It's unfortunate that misinformation is creating a perception for Canadians that belies the reality.
Officials say Canada's ready to quickly detect and stop the virus from spreading.
Any imported cases, we will be rapidly preventing any further spread from that case.
Lessons learned from the SARS outbreak in 2003.
We have had 17 years or so since the SARS outbreak that has allowed for us to have a much more collaborative, much more responsive system.
That system centers around constant communication. Minister Haidu and Dr. Tam fielding calls from each other, provinces, federal departments, and international partners like the World Health Organization.
We have activated our Emergency Operations Center at the Public Health Agency.
And tomorrow the Prime Minister meets with the Incident Response Group and Emergency Committee. But there is criticism. Some are calling for stricter screening and detection measures at airports, where right now self-reporting plays a big part.
Obviously, the stewardess didn't notice because otherwise they would have flagged them at that point. So that failed. And then now, coming off of the plane, there's a screening kind of questionnaire. There's like a poster that says, if you're ill, please report. And so that should have been picked up at the terminal side. And that failed.
Another task for the federal government is dealing with the 67 Canadians so far registered in China's Hubei province under lockdown. Canada hasn't sent a plane to get Canadians out, but it does have consular officials on standby to help. Ashley Burke, CBC News, Ottawa.
No question, the center of the fight against the virus is in China, where officials are going to extraordinary lengths to contain the outbreak, and where so far it's not enough. Soon after appearing in Wuhan, it quickly spread to China's largest cities and to virtually every corner of the country. This despite government travel restrictions affecting tens of millions. Charting the course of the epidemic so far, the steep increase of infections and deaths, the curve suggests this is far from over. Sasha Petrusik shows us the campaign in China to control the illness and the message.
Stung by outcry over Wuhan's overcrowded hospitals and doctors struggling without resources, Beijing tries to show it's in control of the epidemic consuming this country. Soldiers arrive with supplies, as do hundreds of doctors from all over China. And the government is building 2 hospitals at breakneck speed, designed to treat more than 2,000 of the infected. State TV is also showing successes, like the story of Zhang Chengcheng, a medic infected with the coronavirus, now recovering. I feel I'm in pretty good shape, he tells a reporter standing outside his hospital room. My fever's gone and I don't cough so often. But that optimism contrasts sharply with big increases in infections and deaths even in the past 24 hours. This is still a city and a region locked down. Roads, planes, and trains all blocked in a desperate attempt to stop the virus. The mayor of Wuhan predicts the number of cases here to go up by another 1,000 in the coming days. Beijing officials painted an equally grim picture today, expecting the virus to become stronger and spread farther. It's all very new, says the deputy director of China's National Health Commission, Li Bin. Our knowledge is limited, and the epidemic is not in control. In fact, many fear the situation is already far worse than government officials are telling them. In Hong Kong, for instance, where they still remember the huge toll from the SARS virus.
I'm
worried, says Peter Cheng. We must close our borders.
And so, Sasha, an entire province is locked down, the virus still spreading. Any sign of what steps China will take next?
Well, at this point, it looks as though some of the parts of China are taking their own initiative. But later today, bowing to public pressure, Hong Kong did close its borders, and it banned anybody who had been to Wuhan from coming into Hong Kong. We're seeing this in more and more communities, individual communities around China, towns that are simply deciding to close the roads to keep outsiders out, to try to keep the virus out. In some cases, they're dumping dirt on the roads or digging them up even. It's a very local initiative, but it means that you could see in the next foreseeable future that China itself could be locked down and transportation could well be paralyzed. Ian?
Sasha Petrusik in Beijing, where it is already Monday morning. As you know, a small number of cases have been reported in a dozen countries outside China, including Canada. But no matter how far and fast a virus spreads, it can still be outrun by rumor and fear. Vicadopia lays out what researchers actually know and what they're doing about it.
These researchers usually just study virulent diseases. Now they're helping protect doctors and nurses from one on the front lines in China.
The masks and the Tyvek suits are going to keep those people safe from contracting the virus and let them able to do their job.
This virologist is also part of a network of scientists answering the call to develop a vaccine for this coronavirus, but it's early days.
It could take years. Of course, considering the current situation, researchers as well as public health officials might be looking to expedite this process.
Emerging research just published in The Lancet shows how urgent the need could be. One study traced a family of 7 in China who got sick 2 weeks ago. They had no history of contact with animals, visits to markets, including the market in Wuhan, or eating game meat in restaurants. The other paper looked at a group of 41 coronavirus patients, most of whom were otherwise healthy. 6 died, leading the authors to conclude, we're concerned the 2019 coronavirus could have acquired the ability for efficient human transmission. Then there's the dire warning from China's health minister. People who don't even have symptoms could be spreading the illness.
This is how rumors and infection control get started.
This infectious disease specialist says early findings during outbreaks should be viewed with caution because they're often based on the worst cases. And he says the risk of patients spreading viruses before the onset of symptoms is small.
But they shed many-fold more virus when they have symptoms. And when they have symptoms, they're also coughing and spraying the virus out. So, you know, all the experience with these viruses to date says that asymptomatic transmission, if it happens, it does not happen very often.
One of the best ways to control the spread of the virus remains protecting those on the front lines. Vicadopia, CBC News, Toronto.
And a little later on the National, I'll speak to someone on those front lines, an infectious disease specialist. Should we be concerned about how the virus has been spreading? Are we getting the information we need right now? Answers to those questions and more are ahead. And now to what was a heartbreaking day for 2 families in Toronto. Services were held for their loved ones. They were on board that Ukrainian airliner when it was shot down by Iran.
They were full of love, both mother and daughter, and they always wanted to do good.
The caskets of Sahar Hadju and her 8-year-old daughter Elsa were draped in Canadian flags.
But I want to just bring up one thing. I'm proud of those flags. I'm proud of those flags.
A shattered family comforted by an outpouring of support and each other. Shannon Martin now on another father's loss.
This is my son's room.
The memories are everywhere, some comforting.
He loved dinosaurs.
Others just too much. It's the first time he's been home in 2 weeks. Hadi Ahmadi flew to Iran as soon as he heard the news. His wife Behnaz and 9-year-old son Ramtin were on board flight PS 752.
She was wonderful wife, the best mother, best friend, kind to everyone, very generous. She always had a smile. Ramtin had short life. My son was lovely, happy, energetic, and friendly with everyone. As soon as he would see someone, he would hug and say hi.
It's your wife and your son, they're your whole life, your whole...
Yes, and I don't have them anymore. So everything is gone, all of a sudden.
They were buried in Tehran, something he says his wife would have wanted. This afternoon, more than 300 people gathered north of Toronto to say goodbye.
She made her people, her family, and her friends in both lands, Iran and Canada, proud.
A dedicated mom and a little boy loved by so many. The outpouring of support from his community and across the country felt deeply by this father. Back home, he says that's what helps keep him going, that and the memories that fill his home.
Tell everyone that how much I love them and how much I miss them. It's impossible to forget them. It's impossible to live without them.
Shannon Martin, CBC News, Toronto.
And Canada continues to pressure Iran for more participation in the crash investigation. This week, the Transportation Safety Board said it has been invited to take part in analysis of the flight recorders whenever and wherever that takes place. But those black boxes remain in Iran. A Go Public investigation, a family speaking out about the death of a loved one and the abuse she suffered in her nursing home.
I feel like a hitman because we were paying to have our mother killed.
Up next, when a nursing home fails, what are the consequences?
How were you affected by your experience in the Holocaust?
A survivor's story captured as a hologram for generations to come. And later, an ER doctor on the front lines on preparing for the coronavirus.
Are you seeing people coming in who think they may have the coronavirus?
All that and more ahead on The National. The family of an Alberta senior says they are in disbelief about her treatment in a nursing home and her death. They're also angry about how the provincial government responded, so they reached out to the Go Public team. Here's Erica Johnson.
How do you treat a human being like that?
Dana Iwashko is reeling over a scathing government report that found staff at his mother's nursing home abused her. Josephine Iwashko was a resident at this nursing home, owned by one of the biggest for-profit chains in the country, Extendicare. She started developing painful urinary tract infections over and over, sitting in wet and dirty diapers for hours, her family says.
I would go there and all of a sudden she'd kind of pull it herself and she would say, ow, ow.
The family also complained that their mother seemed thirsty, that her water glass was often out of reach. In November of 2018, Josephine was transferred to hospital. According to an investigation by the Alberta government, she was barely responsive. Blood work detected critically high sodium levels, an indication of dehydration. Skin in her mouth was sloughing off due to dryness. She died shortly after. Nurses and care aides admitted to investigators they were too busy to properly care for Josephine. A computer system that tracks the health of residents issued a dozen alerts about her condition going downhill. All were ignored.
Sometimes I feel like a hitman because we were paying to have our mother killed.
Only Alberta and Nova Scotia have the ability to issue financial penalties when nursing homes cause harm. And in this case, the Alberta government didn't fine Extendicare and wouldn't tell Go Public why, saying only the home could be fined if it doesn't follow a number of orders, including educating staff about the importance of hydration. This seniors advocate says regulators across the country need to be given the power to fine nursing homes and to use that power with repeat offenders.
We need to ensure that there is a quick and unequivocal system in place to bring operators into compliance.
A spokesperson for the nursing home says Extendicare is very sorry about the death of its resident and says the home has taken steps to address the situation.
So, Eric, as you point out, Alberta didn't issue a fine here, but you also found out that the province never has in any case.
That's right, and we asked why that was, didn't get a response. Also, the other province with the ability to issue fines, Nova Scotia, has never done that either.
And briefly take us through the debate over fines.
Well, we know in Ontario, when they tried to introduce fines about 3 years ago, the nursing home industry pushed back, and they said that if they have to start paying penalties, that would take away from money used to provide care. The opposite of that, of course, is that fines should be an incentive to deliver proper care and a penalty when that doesn't happen.
All right, Erica Johnson in our newsroom here in Vancouver. Thank you.
Thank you.
And remember, our Go Public stories come from you, so if you have a tip for Erica and the team to investigate, send an email to gopublic@cbc.ca. All right, ahead tonight on The National. Saying goodbye to a slice of Canadiana, die-hard Zellers shoppers make the trek to watch the doors close for one last time. But first, from your perspective here in Vancouver, what's your message to the public? An Emerge doctor on how prepared hospitals are for the coronavirus and what you need to know to protect yourself.
people are quite aware of the virus, so of course they need to take some precautions.
A different scene at Toronto's Pearson Airport today. Most passengers and flight crew arriving from China were wearing face masks. And while the risks of a coronavirus outbreak here in Canada remain low, health officials do expect more cases to come. And that is leaving many of you with concerns. Dr. Isaac Bogosh is an infectious disease specialist with Toronto's University Health Network. We spoke to him on Friday, and he's back to help us tonight with the questions that just keep continuing, Doctor. And let me start with something I saw in the news today and I wondered about. China says the virus's ability to spread is strengthening. That sounds dire. What does it mean?
It's unclear exactly what they mean by that. I mean, certainly we know in some outbreaks, throughout the course of the outbreaks, viruses can change, and they may be referring to the virus having a more easy transmission between human to human, but it's unclear exactly what they mean.
And another definition that I'm looking for an answer to is yesterday in that news conference in Toronto, we kept hearing the case there being described as presumptive.
So that basically means that the initial tests that were done at the provincial health laboratory were positive, and then they were going to send the sample to the national laboratory in Winnipeg for confirmatory testing. We know that yesterday, though, with those positive tests at the provincial health lab, I mean, the microbiologist will kill me for saying this, but really, truly, that was going to be a positive case when it went to Winnipeg. But we still had to call it presumptive until it was actually confirmed.
When we look at the map of the spread of this virus, obviously heavy concentration in Wuhan, in China, but spreading to so many countries, even if it's one case in Toronto and one case in Chicago. But looking at that map also, I think, can give people a sense that we're dealing with something dire here. When you look at the map of the spread, what do you see?
All it tells me is that the burden of illness and the burden of disease in China must be big enough that people are still able to get onto flights and travel to any destination in the world. We've now had several in the United States. We've seen them in Europe, Nepal. Of course, we had our case in Canada. So that the burden of illness and the number of cases in China is large enough that even with 1.4 billion people there are enough people infected with this that they can get on an airplane and land overseas.
The dissemination of information is so critical here, and I'm seeing two currents of criticism from some people who say you guys in the media are exaggerating the threat here, and from some people who cynically say the medical establishment is trying to keep a lid on this and not giving enough information. Your assessment?
I think it's been, in general, pretty good. Sometimes there's some sensationalist headlines that we've seen or some outlandish claims on social media, but for the most part, it's been really good. And, you know, I'm impressed with the transparency of the Canadian public health officials. We heard yesterday after this case, within a matter of hours, we heard from public health officials at the federal level, at the provincial level, at the city level, at the City of Toronto, and even at the hospital level. So the communication here in Canada has actually been exemplary and very transparent.
And your communication sure is helping as well. Dr. Bogosh, thank you very much.
Thanks for having me.
If there is an outbreak, emergency rooms across the country will be on the front lines. Earlier today, I spoke to Dr. Michael Curry. He's an emergency physician at Delta Hospital. That is just outside Vancouver. He also teaches at UBC. And I asked him how prepared Vancouver area hospitals are for the coronavirus.
So I think we're very well prepared if we're dealing with limited, isolated outbreaks. We've received a lot of information. We've got testing that we didn't have when the SARS virus made its appearance. So I think we're reasonably well prepared as long as it's isolated cases. Unfortunately, looking at the news from China, there is a suggestion that this might be expanding very quickly, and with a large number of cases, it will tax our ability to provide appropriate care to patients.
Now, you have an interesting perspective because not only have you practiced medicine in Toronto, but you were there during the SARS crisis. How do we compare with Toronto when you get sort of outside that metro area?
I think Toronto, being directly affected by SARS, had a profound impact upon healthcare practitioners in Toronto that dealt with the SARS epidemic. We got a sense of what's involved to have an entire hospital quarantined, what's involved when a quarter of your healthcare staff are unable to come to work. We were able to set up dedicated emergency departments and isolate patients, but that was a trial and error process, and I think the lesson was learned very well in Toronto because they went through it. But having worked elsewhere in the country since SARS, I don't think other places in the country outside Toronto have that first-hand experience or really grasp the magnitude a large outbreak can have.
Are you seeing people coming in who think they may have the coronavirus? Has it hit that emergency room yet?
Fortunately, we haven't dealt with that yet. We are getting a lot of people with upper respiratory tract infections. It is the middle of flu season. We're very busy with that. And the tricky thing with this new coronavirus is that it presents very similarly to run-up-the-mill infections like influenza or other forms of the coronavirus, which most of us have had, that present with less severe symptoms than what we're seeing in the Hubei province outbreak.
From your perspective here in Vancouver, what's your message to the public?
I think the thing is, we're prepared for it. We aren't sure about how serious this is going to be in terms of spreading to Canada or the severity of the illness. A key thing to remember is initial reports tend to exaggerate the severity of these illnesses because only the sickest of the sick are getting tested for this virus. We don't have that sense, and we won't have it for months, as to the true level of danger posed by this virus, both in terms of how severe it is and in how far and how quickly it spreads.
And what about people out there, particularly at this time of year, the height potentially of flu season? How do people manage coping with their own symptoms or even potential symptoms?
I think there's two main things for people to keep in mind. If you have upper respiratory symptoms and they're in line with colds, influenza, and other respiratory viruses you've had yourself, unless you have travel history or a known exposure to somebody who's been exposed to the coronavirus or has traveled to central China, you should probably treat it as you normally would. If your symptoms are worse, if they're new, or in particular if you're experiencing significant shortness of breath, then that's a time that you should present to the hospital and get further investigations.
As I said, calm, measured advice. Dr. Curry, thank you very much.
Thank you, Ian.
And we will continue to bring you the information you need to know on the coronavirus in the days ahead. But up next on The National, we'll take you behind the scenes as a Holocaust survivor shares his story to be preserved as a hologram for generations to come.
We would like the next generation should know what we went through. And it should never happen again.
Tomorrow marks 75 years since the liberation of Auschwitz by Soviet troops. It is a somber anniversary at a time when anti-Semitism is on the rise around the world. Elderly survivors and their families started gathering today at what's left of the death camp, some likely for the last time. That's why we're seeing efforts to preserve their testimonies before it's too late. One new project at the University of Southern California goes a step further, using artificial intelligence to create 3D holograms and bring their stories to life even after they're gone. Ioanna Emiliotis spoke to the first Canadian Auschwitz survivor to participate.
We are ready.
Max Eisen survived the nightmare of his past by looking forward. Now he's come here to step back in time and relive it over and over again.
My name is Max Tibor Eisen. I was born on March the 15th, 1929, in a town called Moldava nad Bodvou in Czechoslovakia.
This is the extraordinary process of bringing history to life.
I was a busy kid. I went to public school. I went to Hebrew school.
A 26-camera setup in the Los Angeles studio, designed to capture every angle of Max's testimony as a Holocaust or show a survivor, to preserve his story and turn it into a living one.
At first, I sort of thought it was kind of eerie, and that means the end of life, and you're only on a wall there. But I've sort of come to realize that this is a new technology, and it just could do a very big, important job.
How were you affected by your experience in the Holocaust?
Well, it was the loss of family. It was a whole new ballgame, as they say, coming back. How do you pick up the pieces?
Max is the 25th survivor to be interviewed by the University of Southern California's Shoah Foundation with the purpose of creating a hologram, or a three-dimensional interactive image. It will be installed in museums, brought to schools. Anyone who touches a screen can ask Max a question, and his hologram will answer it.
We train the software behind the system to understand sets of questions so that when you come up with your own unique individual way of asking a similar question, the software behind it uses machine learning to say, oh, I know this question, and I know that this question means this answer.
Obviously, did the Holocaust affect your faith? Yes, obviously we need that one.
How can you...
Kia Hayes is in charge of the project. She and her team have come up with nearly 1,000 questions to cover off what anyone might ask Max.
Why do you think the Holocaust happened? Why didn't more people help Jews during the Holocaust?
Not every survivor is up to the task.
It's not just that they physically can sit for the 5 hours a day for 5 days a week to tell their story. It's also mentally and emotionally. Are they able to, but do they want to? So that we know that we're not overburdening them with the amounts of questions that we're asking. And that's really important to us. All right, let's keep going.
Okay.
We have more questions. It might be hard to believe, but there are more.
Okay.
Yet, however gentle the approach, Kia has to keep Max on track as he unearths the darkest period in his life.
Were you ever depressed, or do you think that you ever had PTSD?
I don't know. I don't think I ever had PTSD. I always managed to work my way through it.
Max's emotional stamina is remarkable, especially for a 90-year-old man.
They come at you with all these millions of questions, and you can't think out what are you going to say. You need to be fast, and I think that's the best way I can perform. You know, I hear a question, I just give them an answer right away.
Max, can you share your picture with us?
Yes. I have a picture here that was given to me when I returned from the camp after liberation.
So much of his story is about loss.
And you will see my father and my beautiful mother, and in the center, myself.
A young boy, once nestled in a large, loving family, the only one to survive the infamous Auschwitz concentration camp.
Simply losing your entire family, and how do you pick up the pieces? And grandparents, uncles, aunts, cousins, they simply disappeared. And a year later, they were not there when I came home.
How do you keep the memory of your family with you every day?
Well, I think about my mother a lot, and I think about my brothers. I know my younger brother, everybody knew that he was a genius, what he could have been.
All right, thank you. Guys, am I crazy or is his resting pose different?
The whole exercise is grueling.
So I'm so sorry. That was perfect. I'm going to ask you to do it again, though, in this position.
Yet there is a detachment, a distance from his own story.
Are you able to speak about everything you remember?
There are certain things that I cannot talk about for my own self-preservation.
Did you tell your children about your experiences?
I believe we told them age-appropriate things, and eventually I think they found out.
I've never actually heard him answer some of these questions before.
Max's son, Ed Eisen, came along to support his dad. He says part of his father has always been remote.
He just puts one foot in front of the other. So this is the way he expects everybody to be. You know, like that's his understanding of how you deal with things. Some of those questions are pretty tough to answer.
Max says he needs to be stoic.
When you were recounting these very awful details, you're not emotional. Is that deliberate?
Yes, it is deliberate. I don't want to break down, and I don't want to make anybody cry. I want them to learn, you see, and I know there are some survivors that cry, and everybody else is crying with them. So that's not my way of doing things, you see. Pingus, what do you think of your hologram?
It feels a little strange when I watch myself, but I feel that it's so important. The actual project is so important.
A fellow Canadian survivor, Pinkas Gutter, was the prototype.
It's actually quite difficult for me both to do it, to relive what I'm talking about.
Taking part in this project means Max will continue his work after he's gone.
This is amazing to me, you know, to hear this.
How do you feel about the fact that you're going to be on a screen like that at the end of this process?
I hope that I'll be giving the right answers, you know. So I think it's amazing. It will be gone, and we'll be still speaking to you from the other side. And who would have thought such a thing can happen?
Thank you, Max. Okay, we are done with questions.
All week, Max has focused on sharing the details.
So I kind of want to end this adventure we went on by playing a piece that you remembered her playing.
Then, for the final shot, Kia asks him to listen to a song a neighbor played when he made it home after the war and found only ghosts.
Wow. Thank you. Thank you.
We're actually going to cancel your flight and not let you go home.
So much. Oh.
He's spent a draining week facing his own mortality, and he's relieved when it's over.
I feel great. Mission accomplished. It's amazing, you know. It's amazing, guys, girls. Wonderful.
This is to you. We promise to do our best by your words and your message and help you preserve your story.
As we say, may their memory be for a blessing.
It will be at least a year before Max's hologram is ready, but he's already left a remarkable imprint of his legacy behind.
And just what I needed. What a way, a wonderful way to finish. Thank you, guys.
Joanna Rimmeliotis, CBC News, Los Angeles.
A remarkable man. Tomorrow night on The National, we'll take you to Germany, where they are again grappling with an alarming rise in anti-Semitism. And we'll also bring you coverage from Poland, where survivors and their families will mark 75 years since the liberation of Auschwitz. That's also where Susan Bonner will be hosting a special edition of The World at 6 on CBC Radio 1. Stay with us. The Moment is up next.
More savings, more rewards, more money back. You'll find huge savings like Emerson Remote Control 20-inch color TV or VCR, only $257 each.
What a deal. Remember the old Zellers commercials showcasing everything we wanted back in the day, including VCRs? The last two stores closed today. We went to the Toronto area Zellers as it shut down for the last time. And guess what? There was a group of teenagers there who drove in to witness the end of a retail era. Their walk down Zellers memory lane is tonight's moment.
I heard on the news that Zellers is closing forever today, and I kind of wanted to be there when it all, when it was all over. And we all grew up with Zellers, It was like part of our childhood. We go to the mall, we go to Zellers. It's just something special about it. When I was a kid, my grandma would push me around in the cart at Zellers, and she'd take me into the Zellers restaurant. We get a meal. I'm like, the Zellers restaurant is like, I miss that thing.
I can remember it was always busy. People were always there because, good deals, always restocking and stuff. I can always remember it was busy. Yeah, that's just how I remember it.
It was like Costco. It was really busy, and I always got hit by shopping carts.
Zellers really wasn't like any other store. It was a budget. It was like Walmart, but it had good clothes. It was Walmart, but it had the restaurant. It was like Zellers in its heyday was just the place you wanted to be in the mall.
We did not set that up. We sent a producer to that store, weren't allowed inside for some reason, weren't allowed to talk to anybody on this last day, and then these 3 teenagers show up who are so nostalgic. So am I about Zellers. Remember back in the 90s, there were more than 300 stores, and I had no idea that 2 were left, and of course tonight, no more. That is The National for January 26th. Good night.